All right, good morning and welcome to the Pitt County Board of Commissioners meeting. This is the budget workshops for Tuesday, June the 2nd, and Mr. Melvin McLaughlin, our chairman, will convene the meeting.
Can you hear me?
Yes, sir.
Okay. Good morning, everyone. We are about ready to start the budget workshop. At this time, I would like to ask the clerk to call the roll, and we shall proceed.
Chairman McLaughlin.
Here.
Vice Chair Colson.
Here.
Commissioner Albright.
Here.
Commissioner Fitzpatrick.
Here.
Commissioner Floyd Huggins.
Here.
Commissioner Nunnally.
Here.
Commissioner Perkins Williams.
Here.
Commissioner Ward.
Here.
Commissioner White.
Here.
Everyone is present.
Thank you very much. At this time, we're gonna begin the budget workshop for today, Wednesday, June 3rd. But we would like to ask all of you, if you would, to write your questions or your comments down so that we can go through this process in an orderly fashion. I can assure you that everyone would have an opportunity to ask questions or make comments. We ask the clerk to make sure she call your name after the presentations has been made. So at this time, we'll turn it over to Scott, if you would.
Thank you, Mr. Chairman. This morning we have 3 different groups will present before you: the Pitt County Department of Social Services, the Department of Public Health, and the Convention and Visitors Authority. Yesterday, we did have a follow-up to my budget presentation from Monday, June the 1st. Normally we would get questions after the presentation, but we did have one commissioner email in questions later in the afternoon. And if Mr. Chairman, if you'll indulge us, just to let us real quickly tell what the question was and what answer we have derived from that. So, Mr. Chairman, are we good to go with that format?
Yes, sir.
Okay, I'm going to turn it over to Brian, have Brian read these questions and the corresponding answers.
Good morning, everyone. I hope you can hear me okay. From the manager's presentation yesterday and the 2 presentations that we presented on May 18th, we did receive the following question: how does the enterprise fund lose money every year? Where do the funds come from to cover solid waste's annual losses? As we presented on May the 18th, we are projecting a loss this year, and we did show that we've had losses over the last 2 fiscal years. The enterprise fund has been losing money, in my opinion, based on the fact that we have exceeded our revenues, based on the fact that our main source of revenue is a flat fee, which is our household fee, whereas our expenses are derived based on volume and primarily tonnage each year. So as the tonnage goes up, our expenses go up, whereas our revenue based from the household fee remains flat. So a household 4 pays the same as a household of 1, though mathematically a household of 4 will probably produce more solid waste, which does cost the county more to recycle and to take to the landfill in Bertie County. Where do the funds come from? If we do have revenue, if we have expenses that exceed revenues, just like in our general fund, the solid waste fund has its own fund balance. It's slightly different because from a calculation standpoint, you calculate your cash on hand and you're calculating your capital expenses just like you would in a private enterprise, a private business. So our fund balance is a combination of assets and a combination of cash, but the fund balance is there to fill in the gap if expenses do exceed revenues, and that's what we have been doing the last 3 or 4 fiscal years. The second part of that question, is there a way to help the fund's revenues without increasing the household fee? based on the numbers that we have run, we're not only looking to increase the household fee, but we're also looking to increase several of our tipping fees. I believe the majority were a $2 increase depending on the type of service that was being provided. When you combine that with the household fee, we do feel that the household fee increase, we feel that that's a significant increase of revenues to help sustain the fund going forward. The second question from the presentation was asked, they was asked if staff could look at the positions within the Social Services Department if we were to make changes to the ad valorem tax rate. As the manager presented, the manager's recommending a revenue neutral rate. We were asked to look at if we change that rate from 0.6797 to 0.6802 and 0.6887. The question that was asked was how many positions could we look at adding back to the recommended budget and the Social Services Department. And when you look at adjusting the tax rate to 0.6802, that would generate an additional $71,700. If you looked at changing the recommended tax rate to 68.87, that would generate roughly $1,290,000 and $615. Based on how DSS budgets positions, I can't give you a definitive number of how many new positions will be added if you were to adjust the tax rate, because we receive most of their positions split funding between the county and outside sources, typically the state or the federal government. But if we were to increase the tax rate by either of those two amounts, that would give us obviously a pot of money to look into to determine which positions based on the priority list that was created by Social Services that we reviewed internally as we put the budget together. We would also have to take in consideration the additional costs for equipment, furniture, computers. So if we are directed to look into either of those increases of the tax rate, we would be able to come back to you probably by the end of the week after meeting with Social Services, and we could probably put a list together based on their priorities. Those are the two questions that I received that pertain to the budget. I have a copy of those. I know that was a lot. We can get you a copy so that you can review them yourselves. But if anybody has any other questions, I'll be glad to answer.
So with that, Mr. Chairman, if you would like, we can either take questions or proceed next to the Department of Social Services budget presentation.
Well, do we have any questions from the commissioners in reference to what was said?
No, sir.
Okay, very good. Let's proceed.
Okay, if we can ask Jan Elliott to come forward and her staff, whoever's going to present.
Yeah, public health first.
I'm sorry. Yeah, I'm sorry. Public health is first. I don't know why I was thinking DSS.
Good morning, everyone.
Morning.
Wanted to take some time. I'm sure you're all tired of listening to me, given the amount that I've been before you, but wanted to take some time to review our operations and then review our budget projections and requests with you this morning. As you know, the Pitt County Health Department is fully accredited. The department was reaccredited in March of 2019, having met all of the 147 requirements for accreditation with honors. Much of that credit goes to my deputy director, Amy Haddam, and her team. Amy was not the deputy director at the time, but still was in charge of accreditation last year. We are fortunate in Pitt County to have a true board of health. That board of health is comprised of a physician chair, currently Keith Ramsey. Dr. Ramsey is a board certified infectious disease physician with over 30 years in practice, also board certified in infection control. He was a great mentor and partner for me when I was with Rhody Invited, and continues to be so as my boss, quote unquote, here with the county. We also have Dr. Mark Hayes, our veterinarian. Commissioner Colson is our liaison to the Board of Commissioners. Dr. Scott McIntosh is our optometrist. Tina Dixon and Rex Fleming are community members at large. Tina works for Vidant. I know Rex is with State House Fire. I'm not sure where Rex works. Nitesh Patidar is our pharmacist. Kelly Pack Smith also works at Vidant, one of our at-large members. Does have a master's in public health, by the way. Dr. Martha Engelke is our nurse representative to the Board of Health. Dr. Adam Harrell is our dentist. And Lowell Spate is a well-practiced health engineer who works for the Vidant Health System and is our engineer on the Board of Health. Our mission: to protect, promote, and assure the health of all people in Pitt County. We try to protect people. We strive to protect people from unnecessary environmental risks, such as lead, foodborne diseases, waterborne diseases, and other communicable diseases. We promote individual and community health behaviors, which increase the span of healthy life. And to me, this is really where the money is in public health. We can't treat our way out of many of the public health problems we struggle with. We have to educate our residents and change that behavior and help them to make better health choices. We assure access to essential preventive services for all people in Pitt County. And it's probably never been more clear than it is right now that we are all first responders. All Pitt County Health Department members, regardless of their discipline or normal daily duties, are considered first responders. And in the times of public health emergencies, natural disasters, things like that, we are all called to protect population health in our county. Our organization, the health director, medical director, I serve as both the chief executive officer and the chief medical officer for the agency. The health department is broken into 5 divisions. Our environmental health division that does our food and lodging inspections and on-site wastewater inspections, also is our vector control and mosquito control service. Personal health are all of our clinical services that we deliver at the health department, and a number of our outreach case management services are run through the personal health division. Administration, they help keep us all on track. They pay the bills. They help us prepare our budgets and grant proposals and things like that. Health education is our branch that does all of that, all of our outreach, all of our health education outreach to the community to try to get people to make better health choices for themselves. Then our nutrition division primarily does WIC, but we also do diabetes self-management, diabetes prevention through the nutrition division, including 4 county employees. The health department has over 130 positions from myself as the health director and medical director to our nurses, nurse practitioners, and midwives, our social workers, health educators, nutritionists, other outreach workers. We do have an in-house laboratory and have laboratory technicians who work in the health department. We have our administrative and clerical staff. We have our own dentist now, full-time dentist, and some dental clinical staff who operate our mobile dental unit, the Smile Safari, that travels from school to school in Pitt County, serving the dental needs of underprivileged children. And then we have our environmental health division with its environmental health specialists. I would also mention we have contracts with a couple of folks from the Brody School of Medicine. One is Dr. Keith Nelson. He oversees our OB services and women's health services. And Dr. Paul Cook, another infectious disease expert who provides oversight for our tuberculosis control activities. Our services for children include home visits and newborn assessments, well-child checkups, childhood immunizations, the WIC, or Women, Infants, and Children's Nutrition Program for children up to the age of 5. We do care coordination, formerly known as CC4C, for children up to the age of 5, lead screening up to the age of 6, sickle cell testing and counseling, and again, our dental care for children with the mobile dental unit known as the Smile Safari. Our women's health services include pregnancy testing. I don't know if I've mentioned to the board or not, we looked at the numbers of pregnancy tests for a period of time here during COVID-19, and we found a 55% increase in pregnancy tests from March 1st through about May 12th was the date of that analysis. We do our prenatal clinic and outreach support. So we try to support women in having healthy pregnancies to provide a healthy child at the conclusion of that pregnancy. We have our childbirth education classes, which unfortunately were suspended during COVID. The Triple P program, or positive parenting program, is available to our parents of both sexes, but we've listed it as part of our women's services. Again, I mentioned WIC, which supports our women, infant, and children. The breastfeeding is part of WIC and is highly encouraged through WIC. We provide both in the office and at home breastfeeding education and support, family planning, including various birth control methods, and breast cancer and cervical cancer screening. We have also recently added a program known as Wise Woman, which again targets low income and minority women for cardiovascular disease risk reduction. Our general services, we provide screening for cholesterol issues, diabetes issues, blood sugar issues. We do blood pressure screenings. We provide general immunizations to people in the community who need those. We provide tuberculosis testing and screening and follow-up for those. We provide directly observed therapy, where one of our nurses goes out to the house and administers anti-tuberculous medicine to active tuberculosis cases in the community. Much of our clinical work revolves what are formerly known as STDs, sexually transmitted diseases, or sexually transmitted infections, both from a testing and treatment standpoint, and then our general communicable disease control, which will include things like pertussis and foodborne outbreaks. Service eligibility. We service anyone regardless of ability to pay. Fees for I think pretty much all of our services are based on income and family size, and there's a sliding scale that can slide from the full price to zero based on income. Our environmental health division conduct inspections of public food service establishments, childcare centers, schools. And when we say the hospital, we really mean the food service at the hospital. We do not inspect or regulate the patient care areas of the hospital. Our on-site wastewater division evaluates soil for the suitability of on-site wastewater systems, which means septic systems in the more rural parts of the county, parts of the county that don't have a municipal sewer system. We inspect swimming pools. We provide surveillance and control of mosquitoes. We also do some well permitting in the rural parts of the county as well, and make sure that when a well is abandoned, it's properly abandoned. Health education, does all of our community health education through presentations, through consultations, various program development that we do, programs that we run to try to get people to make better health choices. We also provide some wellness services, both for county employees and for the residents of Pitt County through this program, including flu shots and other immunizations. Vital records are another task that is placed on the health department. The local health director is the registrar for all birth and death certificates occurring in the county. Every year we see over 3,000 births and 2,400 deaths in Pitt County, and they are processed through Pitt County Health Department. About 2,000 of these births and 1,300 of these deaths are in Pitt County residents. The funding that supports public health. Our revenues for this fiscal year, we were budgeted at $11,864,223. As of 3/31/20, we had received $8,438,594. Our proposed budget for this year is $12,345,104 in revenues, and our expenses are matched to revenues, so the budget is balanced. There's a note that we have to hold a certain dollar value out for payroll accrual, and you'll see that through the next several slides. Proposed revenues, state and federal funding, $3,326,948, or about 27% of the budget. County funding, $6,210,295, about 50% of the funding. Fees and charges, $1,691,513, 14% of our budget. Fund balance, $612,043, or about 5% of the budget. And then miscellaneous funds, $504,305, or 4%, totaling that $12,345,104, or 100% of the budget, again with the same notation regarding salary accrual. Proposed expenditures, salary and fringe for our employees account for $9,856,263, $856,263, or about 80% of the budget. Our operating costs, $2,488,841, or 20% of our operating budget. Again, totaling 100% and totaling the $12,345,104 number. Grant funding, we receive over $3 million currently in grants from national, state, and local sources. Some of those grant dollars are passed through to other agencies in the county that can better deliver the service. An example of that are the school nurse funding initiative dollars. We pass those through to Vidant Health. Vidant Health hires and employs the school nurses who during the school year work in the schools. During times of emergency, those nurses are available to us as a surge workforce, nursing workforce for public health. We also pass dollars through to the ECM for Change program. That's a needle exchange and safe injection program. Has been very successful and thought of as a model for the state. Some of the state folks have been down to look at how that program is done. Justification for additional 2021 funding request. Every 3 years, we are required to complete a community health needs assessment. It's required by the North Carolina Department of Health and Human Services. We do this every 3 years. We do this in conjunction with Pitt Partners for Health and Vidant Medical Center. The hospitals under the Affordable Care Act were drawn into this and doing a community health assessment. Unfortunately, it wasn't originally on the same time frame as the health department, so there was some work to get those synced up. This examines the health status and health indicators for the county to determine health priorities for the next 3 years. In 2019, the Board of Health held strategic planning sessions where they reviewed these health needs assessment and derived the following priorities: infant mortality prevention, chronic disease prevention and control, risk factor reduction, including physical activity, nutrition, substance abuse, use, including tobacco, and sexually transmitted disease or sexually transmitted infection prevention and control. The Board of Health's top priority was the reduction of infant mortality. Infant mortality is the death of a baby who is born alive but dies before his or her first birthday. As with so many things, there's a great disparity in infant mortality, both in the state and in Pitt County. If you look, the cones to the left represent the Pitt County white non-Hispanic infant mortality rate, which had a peak of about 7 in the purple year, which was 2012 to 2016, or purple grouping. If you look at the taller cones, that represents the infant mortality in the African American community in Pitt County. And while there's been some improvement in it, it is still drastically higher than it should be. We were requesting, and this is in the manager's recommended budget for the year, one new full-time equivalent for our infant postpartum home visiting program. This is a nurse who will go out and visit those newborns and their mothers to help with that child and help with the mom orienting to that new child. The cost for that is projected at $72,392 as a grade 70 step 1 public health nurse. The one request that we do have that is not in the manager's recommended budget is for an additional physician extender. This would also help with our prenatal care. This would help with our women's health in the clinic in terms of family planning, providing long-active contraceptives to our patients, also doing some well child exams. We prefer family nurse practitioners for our clinic because they can see from children to adults in the clinic. We project that cost at $125,523. That's a grade 83 step 1 position. Summary of our fiscal 2021 new positions requested. one full-time nurse equivalent to conduct the infant postpartum home visits to improve the birth outcomes and prevent infant deaths. That's the $72,392 salary and fringe. That's a billable service for both mother and baby, and will pay for itself, will be revenue generating. The 1.0 full-time equivalent physician extender for clinical service and family planning and maternal health programs will be revenue producing. Service provided right now part-time by an ECU contract, which used faculty from the College of Nursing. The College of Nursing no longer has the faculty to provide that support to us from a contractual standpoint. So we feel we need to fill that gap ourselves. And we also have a current physician extender who will be retiring the end of August, beginning of September, who is our senior clinician at the time. And we anticipate replacing her will be difficult, so we would like to get another one on board prior to her departure or retirement. The office needs, this has been deferred, and we concur with the deferral, so I'm going to skip over that. This is part of our capital improvement project, which is currently deferred. Let's look at what our medical records looks like. We still have some paper charts, but many of the paper charts have been eliminated with the institution of Epic. One of the new fixed costs that the health department has been forced to undertake is the right term, but we're required to take is to have an electronic record system now. That was launched in 2019 or 2018, yeah, because it was about a year old when I started in July last year. So about 2 years of working with the system. The Epic is the name of the system. It connects us with the ECU School of Medicine clinics, with Vidance services, also with other institutions throughout the state and even throughout the nation via the Epic Anywhere's platform. We do use Vidant for our vendor support. We have a monthly cost that is about $6,100 per full-time provider in the clinic, and that is an annual cost of about $73,200. Epic is was purchased as an as-is system. So when we add services to Epic, any new report we request, any new service that we want to have programmed into that is all has to be done as an additional charge in order to make that part of the electronic record system. Other reasons for our additional funds requests, we would like to reestablish an STD express clinic. Currently, we don't have the staffing resources to meet the population demand for STD screening exams. It's one thing to screen them. If we screen them and they need to be treated, we need the provider there to be able to provide that service. This will help increase our testing capacity for STDs or STIs in our community. We do need to develop a lab interface for our clinical service or LIMS to help with the reporting of data, which as we've seen with COVID has been a struggle at all levels of government. And there are some scheduled computer replacements built into our budget this year. Other regional employee performance increases are currently on hold, so that's not really an issue. We do need some of this money to help meet our required program deliverables. And we have, again, our clinical service contract ending with ECU for that provider. That's the part of our basis for the physician extender position request. In summary, our fiscal year budget, as we prepared it, was $12,345,104. The county appropriation is $6,210,295. The difference from the manager's recommended budget is $89,919. This represents altogether an increased county appropriation from fiscal year 2020 of $347,040. Look at the budgets over the past few years. And happy to take any questions you might have this morning.
Mr. Chairman, at the time, no hands are up unless we have Commissioner Albright who's raised his hand.
Okay, I want to just say to Dr. Silvernail, this infant mortality rate among the African American or Black population. It seems like it's just overwhelming. What are you doing? These nurses or nurse that comes by, are the people, because I know you have a lot in the housing projects, are they having to pay money or just a free service?
That would be provided under Medicaid for most of those women. If they, there would be no, as far as I know, no direct charge to patients. Marsha, that we don't charge patients? No, if they don't have insurance or Medicaid, the service is provided free of charge. The vast majority of low-income women are eligible at least for pregnancy Medicaid. So we are able to bill Medicaid for those services for both the mother and baby in those settings.
Okay. Are we seeing any reduction in that community now? Is it steady rising or is it decreasing as?
If you, excuse me, Mr. Chairman, if you look back over time, that rate was even higher in the past. It has come down. So there is progress in that community. It is not as fast as we would like, obviously, but there has been some reduction of African-American infant mortality.
Okay, very good. Thank you very much. Commissioner Albright.
Yeah, thanks for the presentation. I'm trying to understand when we are, it looks to me like the county is shorting your request by $89,919. I wondered if you could comment on how that impacts your overall budget. Is that, am I to take that that's actually a twice that because the county puts in 50%? So when we don't give you nearly 90, it hurts your budget by 180. I'm having a little trouble understanding those figures.
We do overall about half of our half of the money that we run the health department on comes from Pitt County. The balance of that comes from state and federal grants. And then we also have a number of local grants that we receive that make up the other difference. If you looked at it, it said the budget is roughly 12 million. 6 million comes from the county and about 6 million in grants and other funding. And then in fees that we generate for services rendered. We plan to add some services that we have been requested to do. We're going to look at that over the summertime. And those will be revenue generating services that are services we've been requested to provide by some of our clients. And they will generate some additional revenue. We did not show that in the budget and did not show the fees in the budget because those services are not available at this time.
Okay.
So I don't know if that completely answered your question, Commissioner. We're close and I'll let maybe Marsha, you want to take a shot at it?
I'm sorry. So the additional 89,000 that we're requesting on top of what Scott recommended is to cover the physician extender, the position due to Dr. Parks is retiring in the fall. We are losing the contract with ECU. We do think we can get someone in at a I guess the step at a lower step. Therefore, we don't want to go against our manager's recommended budget, but we do need this position because we are adding programs. We do have a lot of programs for infant mortality. Nurse family partnership, Mr. McLaughlin, you had mentioned earlier, we do have a safe sleep program. So anybody that needs a crib can come to the health department and take a class. We will give them a crib for $10. So we have a lot of services to help for the infant mortality rate to decrease in Pitt County, but we really desperately need the physician extender position. This is the position that keeps me up at night because we will not be able to have services probably late fall if we don't get the physician extender with our contract ending and our retirement. Sorry, I hope that.
Would that 89,000, would that also cover your other infant mortality position? That's the one you're talking about, the physician extender position?
No, sir. So we're asking for 2 positions.
Okay.
Scott did approve the infant mortality postpartum nurse, which we project on week 8 will start paying for itself. We are requesting, in addition to the recommended budget by the manager, a physician extender position.
And that's the one you're talking about that you need.
Yes, sir.
Okay, thank you.
Yes, sir.
Yeah,
And
thank you.
by the time that position gets advertised, we should have some additional funds with some potential new services that we're wanting to offer this summer to help offset the cost.
Thank you.
You're welcome. Sorry.
Thank you. Thank you. Do we have any other questions or comment? Do I?
Yes, Mr.
Chris
Chairman,
Nunn-
you have
Chris
Commissioner
Nunn?
Perkins, Williams, and then Commissioner Nunley.
Mr. Chris Nunley and then Perkins Williams?
Correct.
Okay. Commissioner Nunley.
So Commissioner Perkins Williams, you go ahead.
Perkins Williams first, is that right?
Yes.
Okay.
Commissioner Perkins Williams, please.
All right, thank you. Good morning, everyone. Dr. Silvernail, I see your mask and I hear your voice and it's very clear and distinct. Is that a special mask you have on? And I appreciate you're doing that, and I understand the situation. But is that a special mask or whatever? Because when I talk, everybody tell me to pull my mask off because they can't understand me. So could you tell me about that mask?
These masks were donated to the county. I'm not sure who donated them.
Okay.
I can check with Mr. Gentry, but he received these and I was fortunate enough to appropriate one from him.
Mhm.
It's reasonably comfortable. It's got a good nose bridge, so my glasses aren't fogging up. I think I also just learned to project as an instructor over the years, so the mask, maybe that means I have a big mouth. The mask doesn't seem to slow me down much, but Mr. Gentry received these as a donation from a community group.
Your voice is very clear, and that's what I get a complaint about. And I have a big mouth too, and my voice quite projects. And I was very interested in asking about that first, as it relates to the virus, and we don't know how long it's going to last and what the impact will be. I know we have the CARES money, but we don't know about the after effect of a virus. I can recall when my grandchildren started school, we had to give them measles and chicken pox and things like that. So we don't know if we'll be able to have funds for that because we're already seemingly common sense say that we'll be in the hole and we're going to have a lot to dig out of based on what we're dealing with. Have you thought about that and what you project because of your medical background and experience and projection as to what we may be faced with afterwards, and if the budget gonna need to change?
Well, let me talk about the medical issue first, Commissioner.
Okay.
There's concern that, well, child exams have been pushed out because of COVID. And there may be some delay when you look at immunization registry data. There's been a delay in delivering immunizations to children. From the standpoint of paying for immunizations for underprivileged or poor children, we receive vaccines from the state through a program called Vaccine for Children, which is a federal program where vaccines are provided down to the state and they're then provided down to the local health department. So for us, is if we need vaccine, assuming that vaccine is available, we can order that for low-income children or underprivileged children through the state, and then that's available to them at no cost, provided they're vaccine for children eligible clients. So from a cost standpoint, the vaccine for, at least for poor children, those who would need to receive vaccines from a place like the health department, that vaccine for children's vaccine is available. We still, as I said, I think Dr. Lenker wants to get through graduation this week before he starts thinking about reopening. We did have some issues last fall with mostly seventh graders who had not received the meningitis vaccine. We have that in stock. Both my nursing director and my deputy director have been working with the school on a campaign to make sure that we get kids their immunizations as needed for school so that nobody is out of school. And that program's been we're a little bit behind where we thought we were. We really wanted to get two options for the children for vaccines to get them on the way out of school this year. But with school ending so abruptly in March, that wasn't possible. And then to catch kids at the beginning of school. And that will happen once we have a hard date for school start and that reopening plan for schools for the fall. So I think from an immunization standpoint, we have access to the vaccines for underprivileged children at no cost to us, and we have the opportunity to provide those to the children through our normal operations, and have a campaign ready to go to make the parents aware that these children do need certain immunizations at certain times in their school career.
May I ask you another question that it will impact the budget that and I know that's why you're here, but a healthy person early and properly educated hopefully will produce a healthy mindset with adults as to how to stay healthy, grow healthy, and be healthy. In your programs, I didn't see anything that get into that, and I just want to know if you have that kind of thing available for the citizens of Pitt County, or are you working in concept or in sync with the medical community here?
Well, that is, we have a number of programs that try to improve health behaviors. Our WIC program, you may have seen earlier this year, we had ads on the Great Bus. We have billboards, the Triple P billboards for the Positive Parenting Program are run through a grant and put out through the health department. We have our childbirth and parenting classes that have unfortunately suspended with COVID. We really resisted that, but as meeting limit size was decreased and social distancing strategies had to be employed, we just had to stop those classes in the short term. But you're right, we want healthy moms. We want them to deliver a healthy baby, and we want to see that child have good nutrition so that they can grow and develop normally. We want to offer those children who have no medical reason not to get vaccines so we can protect them from some of these horrible vaccine preventable diseases that are out there. So we do have a number of programs like that. For some of the adults, our diabetes prevention program, diabetes self-education program, they've been very successful. And if there is a bright side to COVID, I think being able to use some of the telehealth services and virtual platforms to reach our patients and clients will help facilitate our services going forward, assuming the payers continue to allow us to do that and bill for those services when delivered virtually.
Well, the WIC program is the only one that I really hear about or know about, WIC, because of the poverty and the system, but the adults just need education as to how to help with some of the things as it relates to diabetes and that sort of thing. So anyway, that I just wanted to take this time to ask about those things that I know that we'll face with as a community that can impact public health.
If I may, Commissioner, one of the big programs that we run is the Regional Tobacco Cessation Program, which not only includes tobacco products, but also vaping or e-cigarette products. And we house that program for the state. It's a multi-county program. that provide services to Pitt County and 9 other counties. So there's a big emphasis on trying to get younger folks not to start smoking to begin with, or not to start vaping to begin with. And that's run through the health department, and it's done quite well, by the way.
Thank you very much. I forget about the vaping and stuff. It's so new. We have so much on our plate. I appreciate your responses. Thank you.
You're welcome.
Okay, next, Chairman McLaughlin, we have Commissioner Nunley.
Listen, none? Nothing?
I'm good, guys. Thank you.
Is no one interested?
Very good.
We have Commissioner Ward.
Yes, I just have one question. I know sometimes, are we going to make our recommendations, Scott, for anything for us to look at the end of the meeting as we do in the past, or can we make one of those now?
We can take your input now or at the end, or both.
Okay, well, let me just ask Dr. Silvernail, if you had to ID one of the positions that you are requesting that was not funded, is there one that, if that was the only one, could you tell us what that would be? I was thinking that maybe replacing your physician extender, but you can just let me know it now, or we can ask that at the end.
The infant postpartum nurse had been requested last year and was not approved last year. Scott, the manager, has recommended that be funded this year. So right now, the only position that we're asking that's not in the manager's recommended budget is that physician extender position. And again, with some changes in how we have staffed the clinic, using faculty nurse practitioners from ECU, we are down a full-time equivalent in our provider pool right now, and we do feel that needs to be replaced. And it's very hard to hire a fractional FTE in these positions. It's not impossible, but it's difficult to find somebody who wants to work part-time in those positions. So we do feel we need to get that on board. Again, with the retirement of Dr. Parks, Sandra Parks, our senior clinician, in the fall, we'll also have to replace Sandra's position at some point and rehire for her position. So, and I suspect that will take some time. She is a seasoned clinician and will be sorely missed when she retires.
Well, am I unmuted?
Yes, ma'am.
Okay, if you don't want to say now, I'm just trying to identify, if there was only one, which one is it that you feel like would benefit you the most?
I guess if I had to pick, I would probably pick the provider position, because I know without that provider position, our clinic will be very taxed to provide services when that retirement happens, late summer, early fall.
Okay, that's for the person who's retiring. Okay, thank you. That was the feeling I had, but I just wanted to hear it from you. Thanks.
You're welcome.
Thank you. Thank you. Any other comments, manager?
On the other hand, well, we do have Commissioner Floyd Huggins.
Commissioner Floyd Huggins.
Scott, thank you, Chairman McLaughlin. Scott, would you speak on why, what is your rationale on not approving that? Just,
My rationale.
not including that in the budget. I know you had to cut something, so, but.
Well, we had to cut over $12 million worth of expansion requests. And in terms of dropping the actual rate in the reval year from 72.1 to the 67.97, I gotta take this off in order to speak clearly. In order to drop that rate, and also reducing our other revenue sources, the sales tax and other expenses, unless we increase the rate up higher, I don't know how else we would accommodate additional expenditures. You're going to see this across each presentation that you hear this week. Again, there's
Okay.
$12 million in expansion requests that were eliminated in order to bring that rate down.
Okay, I just wanted
If
to
you
know.
hold the rate at 72.1 cents, I think, Brian, we said that yielded how much? About 6 million in additional dollars,
That sounds correct.
somewhere thereabouts. But we realize this is on top of last year's 3.2 cent ad valorem tax increase to the general fund. So with that, the goal, especially being in a COVID environment with restricted revenues, not knowing where the first 2 quarters of the year are going, and also going with the fact that we're not even giving our employees the cost of living next year, nor are we even allowing them to receive their merit pay beginning July 1. The budget proposes to delay that until December 31st to see what this COVID economy does coming out of this last quarter of the year we're in, plus the first 2 quarters of next year. Sales tax still has a big question mark on it, even though we have reduced our projection of sales tax for the new year. So that's part of the rationale. But again, the rate could always be adjusted if you do want to add some things back.
Okay.
And can I make one comment? Commissioner Floyd Huggins?
Mhm.
On those 2 positions, the position that we are requesting is 100% Medicaid funded. So there's no county dollars available
Okay.
going towards that position. And that was part of the rationale for keeping that one in the budget, since there's no county funds going towards it.
Okay. Okay, thank you.
Okay, Mr. Chairman, there's another hands up.
Do we have another hand?
No, sir, not at this time.
Okay, very good. I want to thank Dr. Silvernail for your fine presentation. I assure you, as Commissioner Ward and Commissioner Huggins mentioned, that we're going to be doing all we can do to help. But I think you understand the budget constraints that we are facing, and but we will continue to do what we can do to help in those areas. Okay, if we would thank you again, Dr. Silvernail, for your presentation.
Thank you, Mr. Chairman.
Now, we have here a break, but do you want to continue? Is Jan Elliott in now, or do you need a break?
She's here, and if everybody's good, we can continue on since we just got started a few minutes ago.
Why don't we do that? Social service.
Got to get the microphone where it needs to be. Okay. So first thing this morning is I want to say thank you to everybody for the support that you've given this department over the last year. I also want to invite everybody to come to our graduation extravaganza for the 11 foster children who are graduating this year. We want to thank you for your donation and your cards for those children. We're really excited. One of the young folks is graduating from the early college program, so she really has a leg up. So we want to thank you for all that, and especially Commissioner Albright, who's had a lot of interest in that. The graduation is, activities are on the 9th at 9 o'clock in the morning at the county office complex, so over across the river. So certainly hope folks can join us if they want to. You know, your support has been critical to us. The work that we do is very detailed. It has a lot of meets a lot of the needs in the community, and certainly you all have helped us over the years with that. And we certainly at DSS have recognized the financial situation that is coming as a result of COVID, and it has had and is continuing to have a big impact on our work. Wanted to start this year with talking about a few of the things that we've achieved last year. A lot of this is due to some of the things that you have provided for us over the years. We continue to meet our application processing times in the economic services programs. That would be 90% of our Medicaid applications, for example, are processed in a timely manner. 95% or more of our food stamp applications are processed in a timely manner. Those are the things that we're required to meet, and there are others, so we continue to do that. Our agency-wide staff turnover for the first time has been at below 20%. 18 to 20% has been our norm, and it's been even higher. This past year, it was at 12%. That was 34 positions. That is a testament to the fact that we are now getting more adequately staffed, and that reduces the turnover, because if you're continuing to run, you find that you can't do it any longer and you burn out. We've had no real significant audit findings in fiscal year 18-19. The single audit came through and found an $8 Medicaid error. So out of the millions of dollars that we do in Medicaid, that was a very small error, and that's attributed to the hard work of the staff. Our legal appeals. We have legal appeals on an annual basis due to the fact that we're doing child support, terminations of parental rights, guardianship, those kinds of things. And there were several filed last year. Our staff do really good work on the front end with the court system, with what we're putting together. And so we win those appeals. We do get outside representation to take us through that process, just because it's so time consuming and we don't have the adequate staff to do it. Our child support collections were at a record level last year. We collected nearly $16 million for the children of Pitt County. And they also received an Excellence in Service award from the Child Support Council. Our foster children, y'all have really supported our foster children. We had in 2019, 117 children leave foster care. That is amazing. That is the lowest I've ever seen, the highest numbers, the lowest number of children in care right now. We're down below 200, been below 200 for at least 6 months. That's been 2 years that we've been above 200. So we are just thrilled with the adequate number of staff to provide the services that are needed. And then the work we're doing on the front end are really helping. 30 of those 117 were adopted. The remainder went back to families. And so our caseloads are dropping there. And you will see that reflected in some of the dollar changes that we're asking for. I do have to say, however, that the children that are coming into care are much more traumatized. That means more mental health services are necessary, and so it's causing significant problems with some of the placements that we do. The other great thing about foster care is that the work we're doing on the front end. We have, thanks to you, provided 2 prevention service workers to our child welfare programs. We also are doing a lot of trauma work with children. We have and you'll see down at the bottom that we have gotten into a program that is helping us a lot with children and the trauma that they are experiencing and the trauma that their parents experienced in years past. So the adequate staff, the trauma work, roundtables, all of these things are coming together to help us reduce the numbers of children in care. Oops, I clicked too fast. Our grant funded services over at the Human Services Center, the self-serve check-in has been very helpful. We are not using it right this minute because we're trying to keep clients doing most of the work by phone, electronically, whatever. But it was very helpful pre-COVID and will continue to be after we come back to normal. Our Work First and employment programs. I'm just really excited. We work with hundreds and hundreds of families around employment types of services, but we had over 300 folks this past year that received occupational trade certifications through the work that we did in partnership with PCC, Vidant, ECVC, and other folks. Things like CNA, welding, phlebotomy, construction trades, truck driving. Our folks are getting those kinds of certificates and more and going out and getting a job. So that's really exciting to me, and we need to, I thank our staff regularly. As I said, trauma is a big issue. So we are one of, Pitt and Craven have gone together with Benchmarks, Duke University, and Trillium, and are putting together a major trauma-focused program here for the county. Benchmarks has done this in 3 other counties, and they have seen significant improvement in the types of care, the treatment these kids are getting. It's reduced the number of disruptions in placements. So we are excited that they are expanding into Pitt and Craven together, and we're going through that process right now. So we expect, however, that COVID's going to have an impact on a lot of these things. I mean, the college isn't doing face-to-face training for some of these folks. Things got disrupted in mid-cycle as they were ending this spring. So we're working with PCC to try and get this back on track so that we can continue these kinds of successes, for example. Now, what are our challenges? There seems like every month they want to tell me about a new audit that they want to do on Pitt County. Between the federal audits, the state audits, the single county audits, we are constantly being reviewed. That pulls staff away from the work they need to be doing. It makes staff very nervous. We don't object for folks checking on us, but it still is a time-consuming process. We've had a lot of policy changes, caseload growth. Certainly Medicaid transformation is probably going to start back up. Not real sure what that's going to do or mean, but we had a lot of activity before we were supposed to go live, and all of that, of course, stopped. There was a bill that has been introduced in the legislature already to get that started back, hopefully in January. But again, what that will do with us, we don't know. There continue to be problems with NC-FAST. NC-FAST has been the bugaboo for a long time. Child care was the last thing to go into NC-FAST. It went in about 2 years ago. NC-FAST generates report upon report upon report for us to do corrections about things that have happened through that program or through that computer system. Child care, because it's the most recent one in, has the majority of the reports to work right now, although there's still a lot in the other programs. We, in fact, took one of our child care vacant positions and converted it from processing applications for child care to just working reports. There's so many of them. And this person's carrying a smaller caseload as a result. Our child welfare pressures. There are federal reviews, the threat of state paybacks, legislative changes such as the Families First legislation at the federal level, and raise the age legislation at the state level. A lot of these children are children that will be the raise the age will be part of our foster care system, and so we will be involved with them at various points. We also are beginning to see increased demands on adult services staff. The population is aging, and much of the population has mental illness and substance abuse problems that are adding to the types of work we do with disability and adult services, especially APS and guardianship. And I say here that we've had a lack of state leadership. What I mean by that is our staff call it the red-headed stepchild. Aging services is not seeing the focus and the effort that things like child welfare have. And so it's not had the focus, it's not had the priority. The state puts little to no, less than 1% of state dollars go in to support the aging services, APS, guardianship, those kinds of things. So it's federal dollars and county dollars that are supporting that program, those programs. So we are working really hard with the legislature to try and change that, and have for several years. So, okay, other challenges. We certainly don't know what's going to happen with the budgets. We're looking at the county budget, the state budget, and the federal budget. All are being impacted by COVID. And so no one seems to know what the revenue shortfalls are going to be. We don't know if the governor and the legislature will agree on a budget this year. They didn't last year. And so we've been operating under the prior year budget. We are beginning to see overtime expenses due to some of the caseload growth. We've had some staff turnover. Not as much as usual, staff illnesses. In fact, 15% of our staff are on family medical leave at some point during a typical year. So all that takes people away from actually doing the work. Today, we have 21 frozen positions that are helping to contribute to that overtime need. And we've got to be able to fill these critical positions, or we will certainly be in severe danger. We got into trouble before during the last economic downturn because we didn't fill positions. And I'm very concerned that that could happen again. COVID-19 certainly is something that is scary also. We are right now asking our staff to do what they've been doing all along, and I'll talk about that in a minute. But the thing that is concerning me right now, of course, is we're going into hurricane season. And I need to remind you that our staff are the staff, part of the staff, the health department staff, sheriff's department staff are all in those shelters working during hurricane season. So that is, of course, a concern. You know, when I think about the work that we do and the fact that we have vacancies, other kinds of things, I have to remind folks that we very much are, especially in our economic services areas, we are an assembly line. We have to process the work. The work has to get done. The work has to get done at a certain point in time. Doesn't matter whether somebody's out or not, that work still has to get done. Has to be done properly. And if it's not, we put people's lives at risk. We're violating various laws, court cases, et cetera. And so as I think about that, many of us I know are old enough to remember the Ethel and Lucy candy factory assembly line issue. And you know, we have no place to hide our problems. So it is critical that we have the staff that we have right now and additional staff in the future to keep us from not doing what we need to be doing. It does take us about 6 to 12 months to train most of our positions before they're fully functional. So we still have to meet those mandated benchmarks. So let's talk a little bit about our COVID response. All of our staff have remained, the buildings have been open, the staff have been in the building. We have had all services available, nothing's been shut down. Social workers are continuing to visit people's homes, medical facilities, and other risky environments. We did as much as possible in all of our areas to try and limit access and try and limit face-to-face contact. So that's why I say in economic services, we've done a lot of do things electronically, do things by phone, do things by mail. People have come in the building to drop stuff off, and from time to time, we have actually needed to do an interview face-to-face, but we have tried very hard to limit that face-to-face time. With our visits for our foster children with their parents, most of our parents have been very agreeable to doing FaceTime or things like that during this time period, but we are going to have to start figuring out how to do that again, because do the face-to-face where they can actually touch their children and talk to their children again shortly. Initially, we had a huge struggle to get PPE. We are beginning to, get that. We have masks, gloves. We have hand sanitizer. Much of it came from a distillery. So when you open up that, we went, gin. But so you're going to have some interesting smells from time to time from the hand sanitizer. But we do have hand sanitizer for our folks now. We did have some limited staff working from home. Our social work staff alternated days in the office. They were working from home on the days that they weren't in the office. But we began to consider, as some of the states were reporting, that their entire child welfare unit got impacted and had to quarantine, and so they had nobody. So we figured that having our folks alternate days or times in the office would be a way to reduce that possibility here in Pitt County. It's also impacted our ability to find placements for foster children, for our adults. Staff are having to travel further. There are varieties of reasons for that. A lot of the facilities don't want to take new people in because they weren't positive about their COVID situation. Some were requiring COVID tests prior to placement. There were just a variety of reasons. We have been able to continue to find those placements, but it has slowed us down, and we are having to travel further for some. We recently took a young man all the way to Morganton because that was the only facility that would allow him to come in at that point in time. Staff are fielding tons of questions as the distribution of all the COVID benefits are beginning to roll out. We are over $10 million has been put out in food assistance to our food stamp beneficiaries in addition to what they normally get. Nearly $6 million is going out to families where the children get free or reduced price lunches for any of the schools here in Pitt County. And that's $371 per child for the period of time that's being covered. We've waived terminations in a lot of programs. For example, Medicaid, we are not terminating Medicaid cases right now unless you die or move out of state. So the able-bodied adults with dependent children, we're not terminating their food stamps right now because employment is difficult to find. if they don't meet the requirements. We had to quickly turn around energy checks. This was a project between us and the finance office. We had less than 2 weeks to turn around 2,824 household energy checks to the vendors. That the state gave us that money at the last minute and needed to get it out. That was a total of $33,681. So it was a project for a small amount of money, but certainly beneficial to the folks that were getting that money. Lots of childcare changes. We waived fees, just a variety of things from there. Our Work First program, there's going to be $265 sent to the 199 children who receive Work First right now. We waived reviews for a few months. So all these changes, all these actions are generating notices, mail, text messages, a variety of things to all of the clients who get these services. And so lots and lots of phone calls. Also for the school children's EBT program or food stamp program, a lot of those addresses are not necessarily accurate because people have moved during the school year. So we're going to have to chase all of those addresses in conjunction with the school system. So that's a lot of work on our folks handling those kinds of things. Our applications are increasing dramatically. In April, our food and nutrition applications doubles to about 1,800. Normally we do about 800-900 a month. We're now beginning to see same kinds of things with our Medicaid program applications as people are losing their jobs and losing their health benefits. People are coming in for that kind of assistance. And, you know, that's not really surprising. Our pre-COVID poverty rates in the low 20s, 20%. Our 50.5% of our children live in poor or low income houses. 22% of our children are food insecure here in Pitt County. So it's not surprising that we see this ramp up and this need during these times. I know, you know, the health department was talking about the Medicaid and prenatal care and helping young moms and babies. Over 50% of the babies in Pitt County are born with Medicaid support. And most of those kids are going to get Medicaid at least for the first year of their life. So you know, that's an important service and really goes a long way to help with the child mortality and a variety of other things because it gives you access to care. So we also have assisted with the non-congregate homeless program. We got involved first with the domestic violence folks and some assistance there. And then as the federal government rolled out some of their efforts, we have been working with the planning department and their homeless programs in trying to work through the needs there. So our staff are involved with that. Impact on staff. As you can imagine, with all the thousands and thousands of people, for example, our Human Services Center sees over 3,000 people a month, generally pre-COVID. So they certainly were very nervous initially about all the contacts, all the work that were going to need to be done, no PPE, et cetera. So, but they have continued to do their job. We've done a lot of things to help support them during that process, and they really have been troopers throughout the whole thing. Our CPS folks and our APS folks never missed a beat. They were out doing those assessments like they're always supposed to do. They never missed a beat. Clearly, staff became more fearful when we had a positive case in the agency. Those staff who were in contact with that person, you know, did go out in quarantine. But that ramped up the angst, I think, for all the staff during that particular period of time. I think we're much better now. Some of our staff have health issues that put them more at risk. We have had to deal with, you know, a lot of my staff are female, and not that dads can't help with classwork, but a lot of our ladies have had to deal with, you know, how am I going to balance the school closures, getting my kids' schoolwork done and come to work, and they've done a good job doing that. Childcare concerns for a lot of our folks became an issue. And we had several folks that were nervous about taking their children to childcare facilities because they were afraid the children would get sick there and then bring it home. So they had a double edge there. We've had at least 20 staff, perhaps more, quarantined at various points during this time period. And so obviously everyone is trying to figure out what's going to happen as we move to the more routine and more face-to-face contact. So now we're going to get into the meat of the budget, but I needed to kind of lay that ground. We do a lot of work that the money doesn't necessarily flow through the county budget. So we want to show you all the monies that are generated based on the work that our staff do, and the majority of this money is spent right here in Pitt County. So our Medicaid dollars account for about 75% of our budget, or $253 million. Our food and nutrition program puts about $43 million out into the economy, and that's about 13%. Our child care program puts 10 million, or about 3%. And then everything else that we do, APS, CPS, CAP, foster care, special assistance, all those in-home programs is a long list. That is about 9% of our cost, so, or how our dollars are spent. And we are saying expected right here because the final financial reimbursements for this year have not been done, of course. So out of that $337 million, most of that circulates right here in Pitt County. So when we do our budget, 95% of our budget, and again, that's the money that we generate one way or the other, about 95% of that comes from federal and state taxes. Another 3 million comes from, or 1% comes from miscellaneous revenues. That's various grants, incentives, just a variety of things. And about 4% of our cost are county tax dollars, about $12 million. So out of that $341 million that we generate in activity, about 4% of that is supported through Pitt County tax revenues. I will tell you as a reminder that we have 291.5 staff. Our administrative unit includes my deputy, myself, our legal team, and all the folks that you would think would be in an administrative unit. Our child welfare team, our adult services team, our economic support team, and our family support team. Those are the basic divisions that we have in our agency. So I wanted to remind you of that. You've seen it many times, but I did want to take a minute to remind you of that. So back pre-COVID, when we were looking at everything that we needed to do, this is where we started and what our board approved, like I said, pre-COVID. We did lots of evaluating of positions compared to the workload. We moved things around. I've probably shuffled 4 to 5 positions already. And some of those may have been a mistake because at least one of them was from food stamps, and now food stamps is ramping up, but we moved it to Medicaid. We have looked at our processes. We've looked at our deficits, as generally we meet about 60% of the current MOU requirements. There's 17 MOU requirements that the state has put on us, and we're regularly meeting about 60% of them. We looked at risk to clients and risk to staff. Each of the requests we made initially was much needed, and several of these have been requests that have been made in prior years and not funded. And so I'm not going to spend a lot of time talking about these. The dollars that you see in county dollars here are the salary, fringe, and equipment costs for these positions. And I have data to support all of these, certainly. I'm going to hit a couple high spots just to give you an example of some of the reasoning behind some of this. For example, the 2 Medicaid positions and the second party review positions, the 3 second party review positions. You know, our Medicaid program has grown by 24% in the last 2 years. Medicaid is a very high risk, low cost because we get 25% funding. I mean, we get 75% funding from the federal government to support this program. So high risk in that any dollar error, we're responsible for 100% of any funds that were paid out in error. So if I paid for your heart surgery and you were not eligible, the county is on the hook for that entire amount of money. And we looked at insurance. The insurance projections that we saw from a company that is insuring some of the counties was it would cost us $85,000 to buy the insurance, and we would have a $10,000 deductible for every error that was made before they would start paying. And so it appears, and there's no reimbursement on any of that. So it appears to us, if we can do a good job on the front end and reduce the likelihood of errors, it is a much more cost-effective prospect. So that's some of the Medicaid thoughts. Our crisis intervention program, we'd seen 9% growth just in the first 7 months of this year, based on the volume of folks coming in needing that assistance. We've had 16% growth in the last several years. We've not added staff in this area in a long time. So, and I can do the same thing for all of these programs, but because, or positions, but understanding where we are and that we are in a COVID environment with uncertain monies, we have reduced what we consider our most critical positions. And again, just as a reminder, when the economy tanks, our work increases. We see those effects quickly, and we see those effects for a longer time. Our food stamp caseload had finally dropped to levels that were similar to where we were in the last downturn before we ramped up. And so now they are certainly starting to jump back up. The mandates remain, as I've said before, timeframes, procedures, benchmarks, paybacks, monitoring, all that oversight remains every day. So the 5 most critical positions, and number 1 would be the income maintenance tech receptionist position that the manager has recommended in his budget. The cost for that is $22,000. And as I said, that includes salary, fringe, and the equipment. That's the county cost. So I'm not going to spend any more time on that. The program manager position for permanency planning. Clearly, we've said this would do improve child safety, assure benchmarks and compliance, and reduce the span of control. And so let me run through why that's important. We have a program administrator for child welfare. She supervises 10 supervisors, 2 clerks, a licensed clinical social worker, and a data analyst. Now, remember, children die in this area. We are required to meet a lot of requirements here. We have about, 50% of the staff that she supervises have been in the job less than 2 years. We have 2 retirements that have occurred as supervisory positions. We have 1 person who left as a supervisor, all that in this current year. So we are seeing significant support needed from this program administrator, but with the volume of people she's trying to manage, that is just too many people. Again, the county cost would be $34,000. The program administrator would supervise this particular program manager position. The income maintenance caseworker for Medicaid, we've talked about Medicaid all day long. I'm not going to spend a lot of time on that other than to say that errors can be costly, and certainly if you don't get quick access to your Medicaid card, if you have medical issues, it can be risky to the client. The caseloads are growing. And you will get the phone calls when the long-term care facilities don't get paid timely. Unfortunately, those folks start making phone calls because it's their business getting impacted. So the cost for that position, because again, it's 25% county money, is $14,000. The social worker 3 for APS, we've been working trying to upgrade our social services in the adult services arena for a while. You gave us an APS and guardianship position last year. We continue to need to grow in both of these. We had asked for more than that last year. We have seen a 12% increase in our APS reports in the first 6 months compared to last year. We've seen a 25% increase since fiscal year 2017. And I will tell you that with COVID, where we normally see 6 to 10 reports a week, we are now seeing 7 reports a day. So this is continuing to increase, and it's making folks aware that this service is out there. So although we may drop back once COVID kind of levels off, I don't know that we'll ever drop back to where we have been recently. The cost for this position would be $38,000 in county money. The paralegal, there's an error in the handout that you received. We picked up the cost for the attorney we were asking for as opposed to the paralegal cost. When we put this in here, the actual cost is $22,000 for this position in county money. We have just lost our most experienced paralegal. She retired. We have 3.5 paralegals positions already supporting our 3 attorneys. They're responsible for child support, adult protective services, child protective services, guardianship, and permanency planning. And I can tell you that on any given day in child support, we have over 200 cases in court. We are in child support court 2 days a week. That's a lot of material to process on a regular basis. We have 166 guardianship cases that require financial reports, require handling at the courthouse to get the guardianship appointed. Any revisions to that guardianship need to be handled by the paralegal and by the attorney. Our permanency planning caseload is 191, and that too requires a lot of paper to be generated. And a lot of that is done by the paralegal so that the actual attorneys don't have to do that. We feel that this is a very critical position for us. So if you see the 5 positions that we are asking for that are most critical, that would be $130,000 in county dollars. The county manager has already included one of those, so that would be an additional $108,000 county dollars above what the manager has recommended if any of those are approved. So looking at our prior year comparisons, fiscal year 2020, which is the one we're currently in, the entire DSS budget that runs through the general fund was $31,795, $225. The county funds are $11,795, $225. We are this is county manager's recommendation. So this is using those figures. The increase in the county funds based on what's been recommended would be $66,150 or a 0.5% increase. The total budget, again, because so much of our money is federal and state, would result in a 3% increase. So that is one position in all the cuts. If you looked at what we requested compared to what was recommended, our request and the manager's recommendation resulted in a 13% decrease in our recommendation compared to our recommendation. And then an 8% decrease for the overall DSS budget based on our recommendation and then what the manager recommended. So you can see that every dollar comes close to $2 every time you cut a county dollar. And this is all the positions and all the cuts. Okay, so we worked with the manager in identifying areas that we felt could be cut that would not impact us as greatly. And these are the day-to-day kinds of expenses that aren't related to staffing. The foster care board payments, we are recommending we offered $100,000, and we're able to do that because some of the cases are coming down. So you're seeing some return on that investment now. And of course, we were closer to the end of the year, so we could see what we actually were going to be spending this year, so we had better basis for next year. Our agency operating expenses, we cut those by $626,000 in consultation with the manager. That's things like utility supplies, printing, all those kinds of things. Automotive expenses with the recommendation of the new vehicles and then the vehicles last year, we cut those some more to by 22%. Our temporary labor, we've cut that by 43% by $15,000. Now, if I have 2 clerks for all of my services division. One of those retired and one of those left because her mother got sick. I am using a temp right now to replace those 2 clerks because I can't hire. That temp cannot get into a lot of the programs that we have in the computer because she's a temp. And if I don't get to fill those positions, this cut may not be a good cut, but that's where I am right now. The training and conferences, you can thank COVID for this. All of our training and conferences have pretty much been slashed for the coming year. Everything's being done more and more by, over the internet. So we took $65,000 out. The Social Services Institute, the Child Support Conference, all those things are being canceled. So that was reduced. So our overall cut to just line items in the budget is 14%, not counting the staff reductions that were there. So that is sort of my presentation. I certainly will welcome any questions.
Melvin, Tom Colson, I'd like you to put me on the list to ask questions.
Okay, Commissioner Colson.
This is more directed to Scott. Scott, according to this, there's 20 open positions or frozen positions. And in the health department, dropping back to that, I believe they've got 17 open positions. Now, when we county commissioners vote on budget, we approve so many positions. And so these frozen positions have already been approved by the full board of county commissioners. We're saying we want these, we feel that these are necessary and that they should be filled. You've heard me say this before, but I'm really concerned that a county manager has unilateral power to override what we commissioners have directed you to do, which is to spend the money for the positions. And I know that I know the logic behind it, but I object to it from the standpoint, we're talking about public health and we're talking about social services. Two very critical things in our community. And some of them in the health department actually generate money. But beyond that, I mean, every year they'll come up and ask for a new position or whatever. But the last year, I think the health department, we had 130 people that are supposedly on the books, but we really only have 113 now. And it seems to me that since we commissioners have said we want those positions filled, I don't think it should be frozen. And maybe this is the wrong time to do it, but I think it ought to come up in the future at our commissioner meeting that anytime that you're proposing to freeze positions, that you bring it before the Board of Commissioners at a meeting and justify why you're doing it. Because I'd like to be able to say, no, I don't agree with that. And every single year, we carry over $3 to $4 million in unspent money. And a lot of that unspent money comes from these critical positions that we don't fund. And that doesn't make sense to me. Why are we doing that? Seems to me we're shooting ourselves in the foot.
Well, if I can respond, in terms of these unspent funds, this $3 million plug, as we call it, that we're taking out of our savings, we're using it to balance our annual budget. Just like if we had a household budget, that $3 million or that $3 out of 100, we can't spend it because we need it to fall back to fund balance to be part of the adequate reserve. In the past couple of years, I think last year in particular, the board did ask, especially in the areas of DSS and public health, that we not freeze things. In terms of the freeze, prior to COVID or prior to last year, we would freeze positions for 30 days to create lapsed salary. We'd also freeze the position in terms of if an employee had vacation or personal leave built up, which they can build up 240 hours a year. We've got to pay that out of the departmental budget. We can't hire somebody immediately or we'd be paying double salaries. So we were asking the positions to be frozen for that reason. So pre-COVID, I've worked with DSS and public health and have released positions for the most part, pretty much as they would ask for an exception, as they would justify it. The hard, I'll call it the harder freeze we've entered into probably the last 60 plus days is more been a COVID-19 response. And Vice Chairman Colson, I agree. Maybe I should have came before the board and said I propose doing this, but we did do kind of a hard freeze across the entire organization. But again, I've made exceptions within DSS, within public health, as both Dr. Silvernail and Jen Elliott have came to me for those exceptions. As we are looking at the sales tax revenues for the current year, and again, the big unknown for the new year, just trying to make sure that we maintain a fund balance of 18 to 20%, which doesn't even, it's not even on par with our comparable counties of 30% in terms of operating. So, but I do agree, probably moving forward, unless the board wants to do something different in terms of the freeze we have in effect now, we're just, and the reason that freeze is in effect, we don't really know in terms of the first 2 quarters of the new year, how difficult the revenue scenario could be, we might need to do maybe not reduce some positions, a reduction in force. I just don't have that total picture in front of me. So we're trying to preserve those people who are in jobs in positions today so that we don't have to look at somebody who's employed to say, I'm sorry, but we're going to have to eliminate your position. But potentially, if we had to go that route, we would at least have a number of vacant positions that we could then count on for targeting per se.
Okay, and I've heard that explanation before, but it still troubles me. With the health department and the Department of Social Services, do they in any way qualify from the CARES Act spending to be able to have the county reimbursed for some or all of their services during the COVID period?
Well, the way the CARES Act reads, it says that any position that is substantially dedicated to a CARES Act response, yes. I mean, like Dr. Silvernail's, technically in EMS, all of our EMS workers would qualify. Brian, was it anybody in public safety?
Under the guidance that we received as finance officers from a recent webinar with the actual folks in the NC Pro, which is the group that's overseeing the CARES Act, I specifically asked the group because it was determined that all public safety and public health qualify under the CARES Act as significantly dedicated towards COVID relief. That statement was made, and I jumped in real quick on the webinar and asked, are you sure 100%? And my response from both the Association of County Commissioners and the NC Pro group was yes.
Okay, keep in mind in terms of the recommendation we made yesterday, even the modified recommendation, we have a whole lot of expenses and needs besides salaries. Matter of fact, we even cut most of the money out of the proposed spending plan for salaries because we currently have those salaries budgeted. There's other expenses in there, testing being the primary one of the $3.1 million that we have identified, as well as the reserve for COVID-2, if you want to call it, the second wave of COVID that we don't know what effect that might be later this year.
I have another question. This was directed to Janice, our attorney. Yesterday, we voted on the CARES Act, and I voted for it. But I'm troubled now after seeing this and hearing about all these frozen positions and knowing that some of this CARES Act money, $3.1 million, can go towards salaries. I would like to make a motion that we reconsider what we voted for yesterday on the CARES Act, because I want to change my vote I was on the yes side, the winning side of the vote. I want to change that to a no vote. And so would you help me with the proper procedure for me being able to do that? My one vote won't change the outcome, but the reason for it is that there's $478,000 that are dedicated to go to the municipalities based on that CARES Act distribution that was voted on option 2 yesterday. And I believe that we, the county, are going to see substantial needs, and we're not really in a good position to be able to give the city $478,000. So my objection, my reason I want to do a no vote is if there was an option 3 that took out the municipal payment. I have since learned that many other counties that are receiving this money are the cities, the major cities and towns in their area are asking for minimal dollars, $10,000, $50,000, $20,000. Greenville asked for 1.4 million. And we've agreed to give them 478,000.
Well, 478,000 for all municipalities who have.
I understand. It's all municipalities, but who's going to get the biggest chunk of that? Greenville's going to. And I'm not trying to pick on Greenville. I'm trying to look out after the county. We've got salaries that we need to be able to cover, and I think this money can do it. The cities are also, correct me if I'm wrong, they're able to also go out and ask FEMA for reimbursements. Is that correct?
That's correct, under public assistance.
Okay, and we can too.
Correct.
So I would say they do it, we do it, but this money was actually directed more to the counties, and it's at our discretion whether we want to give the municipalities $478,000. So, Madam Chairman, Attorney, could you please guide me through how can I do a vote for reconsideration, just so I can go on record as a no vote?
Yes, so your rules of procedure allow a motion to reconsider made by a member who voted with the prevailing side. Your rules state that it must be brought at the same meeting as the original motion, but the practice of this board has been to allow motions to reconsider by someone on the prevailing side at later meetings.
So can I do
So-
that now then?
So I think there are two challenges to you doing that now.
Okay,
One is to be sure there's no objection from your fellow board members within the scope of this budget workshop. So you can raise any issue during any regularly scheduled board meeting. And the budget workshops have been advertised as a special board meeting. I think it's arguable to say that this relates to budgeting and so would be within the scope of your special meeting. And if there's no objection from your board members, then you could make that motion.
so, but in the CARES Act falls under budgeting, does it not?
It does, it does.
Okay, so what's the second challenge?
The second thing is that I don't think you can reconsider it just to change your vote. If you reconsider it based on your discussion, I think other people would have an opportunity to change their vote if they so choose.
So then if I were to make a motion that we reconsider based on, I'd like to see the formulation changed to where the municipality maybe was reduced to some smaller amount
Can't.
and distributed somewhere else.
Yeah, and your third challenge would be, because you voted yesterday morning, I've already submitted the forms to the state based on what was approved. At this point, once I get approval from the state, I think your more appropriate option you may want to consider would be a change to the formula that I'd have to resubmit to the state. So
Right, which we can do. They said we
Yeah.
can amend
When,
that.
when do you think that would happen? Throw dart at the board. I know you can't.
I'm pretty sure I'm going to get some feedback from the state before this week is out.
Okay.
So our next scheduled meeting, I mean, obviously, we're in no position to start spending any of that money, at least to the municipal side, anytime soon.
I would
So-
recommend putting on the agenda for the 15th and fully voted on that.
Okay. But from what I understand yesterday, they've delayed the thing from the June 1st to June 15th.
That was just the
And if we have a
deadline.
June 15th meeting at night and we decide something, it won't go in before,
Well, we've already met the deadline for the June 15th by submitting it yesterday. So even if we submit something June the 16th, we'll just be submitting an amendment to
Oh.
what we've already turned in. So we've already met the deadline. We would just be,
okay.
Unless he's asking that prior to the deadline, you withdraw your original submission and submit something in the alternative.
okay.
Well, I don't really want to make
I don't know.
overcomplicated, and I hope my other fellow commissions, regardless of their stance, would understand why I'm asking for this. They may not agree with it. And so,
You might wish to resolve the issue because if the outcome doesn't change, then you're not in a tentative state.
which is okay. I mean, if that's what the majority wants, then that's what the majority wants. All right. What I'm going to do then is I'm going to ask after this that I meet with staff to try to come up with something so that I don't look like an idiot when I'm trying to move $478,000 as an option 3.
So this would come back on the 15th then, or?
If it doesn't hurt the timing in any way, that's fine.
Okay.
Okay.
Mr. Chairman, we had a couple hands up. I only see Commissioner Ward up now. Does staff remember the other hands that were up?
Was Mary Perkins Williams.
Okay, Mary Perkins Williams. And we have Commissioner Ward. Mr. Chairman, do you want to recognize Mary
Commissioner
Perkins Williams first?
Okay. Mary Perkins Williams,
I think Beth hands was up before mine.
Commissioner Ward.
Thank you. The first thing, I wanted to pose the same thing to our health director. It's been so long. Anyway, to take a look at those critical positions and try to identify for us one that I think she did, but I would like for her to formally do that to our staff and let the staff consider what that means. I understand from the staff that we have just about presented exactly what we feel like we can stand. So I'm not really asking or pushing that these be considered. I just like for a money value, and instead of the 5 most critical positions, please let us know 1 from each one. The other thing is the money that's coming to us. I've still understood that once we get it, we can decide to spend it any way we please. Is that not correct? That we're talking about with Commissioner Colson?
Well,
Because I'm
that's
kind of
my-
a board.
if I may respond, that's my understanding as well, but we've kind of sent a signal with this option 2 to the city or municipalities to expect almost $500,000 from us. And I think we're either going to do that, or I think it would be fair to put them on notice and say, look, we really don't think we can afford to send you this money.
Also, as
We have internal needs.
also as we're audited by the state on these monies, we've sent them a signal and shown categorically that we will spend it in these different buckets. So we would need to amend that if the board so chose.
Right. So, I mean, I have no problem doing exactly what you have said, Tom. So if you will meet with the group and come back with something to us, that would be great. Thank you.
Okay, Commissioner Perker-Williams.
Good morning, Ms. Elliott. I know you and I have talked previously about the number of positions that you wanted, and I do know you work hard to reduce those from 29 to essential because of COVID and everything else. First of all, I want to ask you, how are you these days? Because there is a lot of weight on your shoulders with the employees who tested positive for COVID, and then there was some reaction. How are you these days?
Thank you for asking. I am fine. Every once in a while, I feel a bit frazzled, but basically I'm fine.
I can understand. Thank you very much. And I know that the morale has a lot to do with leadership. And I do get to hear from some of the people who not only receive your service, but to also give the service of your department. When I say your, the social service department. But, you know, just getting the calls that I get and having to use your department as well as the health department, whatever. I received 2 calls since I've been on this as it relates to the health. But what I want to say to you is mental health is not going to go down at all. In my own calculations as to what is coming up within the communities. And senior citizens are not going to go down that much because there are a lot of things, and I know you dealt with that. I see your 5 critical ones, and I just don't know how you're going to do everything, because one mistake can take away a lot of monies away from the department. Because you now, with the new policies that this administration have in the General Assembly, you get fined for errors. Am I correct?
They take back every dollar that was spent inappropriately. That would be correct. And it's 100% accuracy. There's no room for any error.
I just wanted the rest of my colleagues to know that this is what you're having to deal with. And you have to have internal audits to make sure that those errors are covered. And when I hear the report as a board member for social services, I think you do a yeoman job. I just want you to know that. But the community makes demands on you that I don't know how you can do sometimes. But they always compliment the fact that you handle them. But I don't know what, I don't even know what I've voted on yesterday as far as the COVID virus. So many things come up. But I do know that we're going to need some mental health. I do know that we are going to need some mental health. I just want everybody to know that we're gonna need some mental health because other things are occurring within the community that we've not even thought would happen.
I can say that we are seeing situations with our child protective services that are, for example, obviously connected to what's going on in the community right now with the stay at home, the domestic violence, all those kinds of things that these additional pressures are making. We're not getting reports from school because school isn't open, but we're getting reports from law enforcement in the hospital. And these are kids who have been very severely injured. And so that I think is sort of a testament to what you're saying around the mental health environment of the community, because folks are very stressed and worried about what's going to happen tomorrow. And it's playing itself out in those areas. So, yeah, and we're pulling staff from everywhere to try and pitch in to cover where we've got gaps. So today's job might not be what you're on the payroll to do, but you're helping me fill in the gaps that we've got right now.
And your staff, how do they receive those abrupt changes? That's something too that weighs on stress and the results of what goes into the state. How are they managing that? And I'm sure you're in.
Excuse me, I didn't mean to interrupt you. Go ahead.
No, go ahead.
I was just going to say, most of our staff are very willing to pitch in and do what needs to be done. We've had a couple situations, obviously, where we needed to talk about the why, and then they jump on it and start doing what they need to be doing. So most of our staff are very willing to do whatever I ask them to do on any given day.
Well, I just wanted to know about that because your still being here is super important. But from the state level, it changes all the time and the budget is not there. I'm constantly asking Senator Davis, how does it look that the budget will ever get passed? And his response is, I don't know. So we don't have an extra pot of money coming into you as the city of Greenville does with the GUC money. But I'd like to know between you and Dr. Silvernails from with mental health, is there some kind of something you all can come up with that can help ease the stress that's coming?
I can speak to a lot of what I've seen going on with Trillium. For example, they had sort of, I'm gonna call it a town hall meeting. It may not actually be called that, yesterday that they advertised. I mean, they're doing a lot of crisis work. I think they've probably trying to get some grants to do more of that based on the responses from the hurricanes in the past and that. So I know Trillium is working to get out there and to try and support folks. But folks have got to know how to reach out. And I think sometimes there's occasionally a disconnect there. So we've just got to get everybody focused on the fact that we do have a resource here.
I know that the disconnect is definitely there because there was time when we didn't know how to access. And I don't know what to say about that, but I just don't want you stressing out, and you can manage the department very well. Commissioner Colson, I don't even remember how I voted with that because I know the needs are coming. And if I get, because I know I have to refer to the department heads at some point, but whatever you want to do for the better of these two departments, I certainly can. I am willing to negotiate my change of vote or whatever is necessary, because while we were meeting yesterday, I had a different issue that was sent to me, and it brought concern that I sent to our county manager, our county attorney, and others. So with that being said, and if there is a need, I see what Tom is trying to do, and I can agree with that because I know there was a need, and our overall population isn't decreasing in any way. We only had 2 COVID deaths, and that's wonderful, Dr. Silvernail, wonderful. Thank you.
Okay. Do we have anyone else, Mr. Manager?
You have Commissioner Albright.
Commissioner Albright.
Yes, thank you, and thank you for the report. And congratulations, especially on the recent successes. They're all terrific, and I'm especially pleased at the reduction in turnover, the lack of legal appeals, and the lack of audit findings. You're doing a terrific job in very stressful times, and we thank you for it. I would like to get clarity on a couple of things. With the 5 most critical positions, I believe you said that one of those was handled by the budget and that we could, I believe it would be the last, the 49,000 for the paralegal. And that I believe if I got this right, $108,000 would get you the other 4.
Yes, sir. The one that the county has recommended to approve in the budget that you have received is the first on the list, the income maintenance technician position. The other 4 are in rank order. And to get those other 4, and remember the county cost on the paralegal is on your document incorrectly. It's $22,000. To get the other 4 would be $108,000 in county money.
Okay, thank you. My other question is when you were talking about the reductions and you came up, you have a 14% decrease. That was done in the prior talking with county staff before the budget was presented to us. Is that right?
That's correct. We put forward some proposals. They put forward some proposals. We were able to come to agreement on that amount.
Thank you. Wanted to make sure of that. Thank you again.
Okay, thank you very much. Do we have anyone else, Mr. Manager?
No, sir, not this time.
Ms. Elliott, I certainly want to thank you and for your fine presentation. And as stated by several commissioners, our manager will be looking at some of the areas of concern and we'll be getting back. Thank you very much.
Thank you so much, everybody.
Ms. Manager, at this point, do you need a break? Or do you want to continue?
We could take a 5-minute break. That would be good.
Okay, we're going to have a 5-minute break at this time. Thank you.
Thank you.
Attention everyone, we are going to begin in 30 seconds. Again, we are going to begin in 30 seconds.
Okay, we are back after a brief break to resume the budget workshops for Tuesday, June the 2nd. And Mr. Chairman, if we can allow the clerk to do a roll call real quickly.
Roll call, please.
Chairman McLaughlin,
Here?
Vice Chair Colson,
Here.
Commissioner Albright,
Here?
Commissioner Fitzpatrick,
Here.
Commissioner Floyd Huggins,
Here.
Commissioner Nunley.
Here.
Commissioner Perkins Williams. Commissioner Perkins Williams. Commissioner Ward,
Present.
Commissioner White,
Here.
Commissioner Perkins Williams, are you on the line?
She may have stepped away. Mr. Chairman, we do have one hand up from the very end. Last time, I don't know if Commissioner Ward had anything or if that hand just needs to come down. I'm not sure.
Okay, Mr. Ward, did you finish?
No, I was just requesting a break and you did it. Thank you.
All right, thank you.
Good. Okay, Scott, it looks like we're ready to go to Andrew with the convention. And
Yes, sir. He's at the podium for the Greenville-Pitt County Convention and Visitors Authority presentation.
All right, good morning. I appreciate you having me here, and I'm just going to give you an update on the 2020-2021 budget for the Convention and Visitors Authority. Our mission at the Convention and Visitors Bureau is to foster an environment of superior travel and tourism experiences. We want people to come to visit Pitt County and have excellent experiences so they can share those experiences and tell more people about us. And certainly we have a lot of wonderful amenities in Pitt County to attract all sorts of travel. We try to attract leisure travel, meetings and conventions, sports, tourism, reunions, and so forth. So we want to make sure that anybody that comes to Pitt County has a superior experience. The 2021 budget supports the following goals. The first and foremost goal is that we want to use travel and tourism to assist the economic recovery from the effects of COVID-19 by restarting travel to Greenville and Pitt County. We know when travelers come to Pitt County, they spend dollars from outside the area. Those dollars help generate needed sales tax revenue and support our local businesses, both hospitality and non-hospitality. So we're working very hard right now on our messaging and our plans to restart travel to our area. The second goal is to recapture both lost and postponed business in the meetings and sports tourism market segments. We've had many cancellations. We've had some postponements that have been rescheduled, and then we have some things that are still very much up in the air on whether they will come back to Greenville and Pitt County or not. So we're working hard on that. Goal 3 is a very important goal. This next fiscal year, we'll work with our local hospitality industry organizations to develop safe practices and policies to ensure visitor health and visitor safety while they're visiting Greenville and Pitt County. I think prior to COVID-19, the most people may look at was a restaurant rating or a hotel rating and look at the sanitation grades. And that was, they felt pretty good about what they saw and that was it. Much different story today. All the traveler research has shown that their mindsets are around health and safety, and they want to be guaranteed that the hospitality businesses that they're visiting are in fact doing all they can to keep their family safe. Fourth goal is lead placemaking efforts by tying together community assets, including art, culture, entertainment, and leisure activities to increase leisure travel. Leisure travel will be the first market segment that will come back in the hospitality industry. People are really looking for closer experiences. All the research shows that drive markets are going to be most utilized. So people are not ready to get back on airplanes yet. And they're also wanting to stay close to home. So that gives Pitt County a pretty good place and pretty good position in the market to attract some of those individuals from the bigger cities to come east and have a day or two. We also have a lot of outdoor recreational activities throughout Pitt County, which is a leading thing that people want to engage in because they can control social distancing that way. And then the fifth goal is to collaborate with Pitt County partners to establish Pitt County as a certified retirement county in North Carolina. That is more of a lofty goal. We know that the city of Winterville right now is our only certified retirement community in Pitt County. There's a new program through the North Carolina Division of Travel and Tourism Office that will certify a complete county. So we'll be looking at that throughout the year to see if our partners are interested in pursuing that. And if so, we may come to the county, not for funding, but just for some partnership in putting together that application. Tourism in Pitt County has been extremely successful in the last 5 years. You can see in 2014, tourism generated about $213 million in revenue for the county. In 2018, that number had jumped to 260.5 million. So a good steady increase in tourism. 2019 numbers are not available. They should be just as good or not better. And unfortunately, 2020 numbers will be much less because of COVID-19. So we've had a lot of great momentum. We had one of the busiest springs ever planned for Pitt County in the ways of conventions, meetings, reunions, and tournaments. And unfortunately, with COVID-19, that has certainly diminished the effect that tourism has had on the local economy. Our board members, we are governed by a board. We have 4 hotel owner operators, 2 from the county, 2 from the city, 2 hospitality related positions, 1 from the county, 1 from the city, 4 citizens that just have a general interest in what we do at the CVB. Again, 2 from the county, 2 from the city, a chamber appointee. We do have a city council liaison, and that's Chris Nunley. And I want to publicly thank Chris for his work and participation on our board. He's very active, and we appreciate his assistance and interest. And then we also have a city finance officer. Byron Hayes acts as our treasurer from the city on our board. Our board goes through our budget goes through a 4-step process. Our executive committee has approved this budget. The full board has approved this budget, and I'll say they've approved it 3 times because we've had to change it due to some changes in funding. City Council listened to this presentation on May 14th, and we're here before the Board of Commissioners today. And just as a reminder, we don't receive any revenues from the county or the city from their general funds. We're not a membership organization, so we don't have membership revenue. Solely the hotel motel occupancy tax is where we get our revenues from. So the people that stay in our hotels pay that 6% occupancy tax. That 6% is divided up between us and the convention center. And at the end of the day, we get about 1/3 of that funding. I'm sorry, 1/3 of that funding once it's split 2 ways. We have seen a significant decline due to COVID-19 in our occupancy tax numbers. And we'll talk about those in just a minute. And the good news, a little piece of good news, is that Airbnb numbers continue to grow in Pitt County. We have about 224 Airbnbs in our county. They do pay occupancy tax. They typically have much lower rates, so they don't put into that tax very much, but it is a source of revenue. So we see those grow. All right, so to give you an idea of how our budget is divided, in 2018, 2019, we collected almost $2.4 million in occupancy tax. From that, the first 50% goes to the city of Greenville to pay off the debt service on the Greenville Convention Center. That leaves 50%, and that 50% is divided up. And 2/3 of that 50% goes to the CVA for our operations, and 1/3 goes to the convention center for convention center marketing. All right, let's talk about our revenues right now at the CVA. So what's collected from July 1st, 2019 to June 30, 2020 is what we will work off of starting July 1, 2020. Since this presentation was given to the city, we have updated numbers, and I'll share those with you. So currently, occupancy tax revenues are down now 13.5%, as opposed to what you see on your screen, 6.9. We got those numbers a few days ago. So we are seeing a significant decline in the amount that we've collected for the year so far because of COVID-19. Our 2021 fiscal year budget is calculated with a 25% reduction in overall revenue as compared to this year. So we're working with 25% less revenue than we did this current fiscal year. And again, COVID-19, we know that it's affected April collections, May collections will be affected, and June collections will be affected. All the conventions, meetings, sports tournaments, all those things that have been canceled. Corporate travel is not happening. There's very little leisure travel. We do have a little bit of construction activity in our hotels, but for the most part, our hotels are not seeing a lot of activity, and that, of course, affects what we do. And then the last bit of information that also affects our revenues is that ADR, which is average daily rate in our hotels, and RevPAR, which is revenue per available room, numbers are much lower as well. So we do get guidance from the Smith Travel Research Report that shows us the overall activity each month in Pitt County, and those numbers are down about 68%. So it's obviously affecting the amount that we can collect through occupancy tax. So just to give you a preview of our budget, the next year's 2021 budget starting July 1 is set at $1.3 million. The occupancy tax collections represent $934,000 of that 1.3. We do have a sports commission starting our second year of our sports commission, which has been extremely successful so far. They will receive $275,000 from our capital reserve account with the city. And then we have our interest from our revenues at $482. And to make this budget work, even though we've had significant cuts, we are going to take some money from fund balance to try to do the most marketing that we can for Greenville and Pitt County, because that is what we do. We're a marketing agency. So we'll take $120,000 of our fund balance to help balance our budget for next year. There is an asterisk by that number, and I want to explain that very quickly. When everything started canceling in the middle of March, our office immediately put a spending freeze on anything that wasn't essential. So we feel that we will come under our budget for this year because we did put that spending freeze in place. So whatever we come under budget, we're estimating about $50,000 will actually be reduced that fund balance that we need. So it'll probably be more like $70,000 that we take out of fund balance. The Greenville Convention Center gets their funding, as you'll see in just a minute, from that 1/3 of that 50% of the occupancy tax that's collected. To be able to balance their budget, they're going to be taking money out of their marketing reserve, which is a separate account that the city has also. So they'll be taking $73,000 out of their marketing reserve to balance their budget. Again, we are reducing our budget by 25% using a little bit of fund balance, but here's the synopsis of what we will be doing for balancing the budget. We will be decreasing our staffing level. We do have 2 individuals that will be retiring. We have a staff of 7 right now. We have 2 that will be retiring, one in August of 2020 and one in February in 2021. So those 2 individuals that will retire, we will not refill their positions right now. We will look at some part-time help to try to get those tasks done, but we will not rehire those full-time positions. We're certainly reducing our contracted services level. We had several projects that we really wanted to look at doing, when we thought our funding levels were going to be higher. And so those have been put on hold. Selective travel, we're going to be doing more virtual opportunities to market. We'll be doing virtual site tours, participating in virtual trade shows. Obviously, we've got some policies in place that say, not more than one person can go to an event, even if we've typically sent 2 or 3. So we've got some different travel restrictions that we've put in place. Sponsorship dollars will certainly be reduced. Last year, we sponsored about $40,000 worth of different activities in our community, from sponsoring Pirate Fest and Free Boot Friday to the African American Jazz Series and the Greenville Museum of Art. We'll have to reduce those sponsorships. And then we won't increase our marketing line items. That's the only line item really that we didn't reduce, because that is the most important thing that we do is market. We have to bring people to Greenville and Pitt County to spend money. And when it is time to truly travel again, that landscape will be very, very crowded. A lot of the different destinations are waiting. And when the floodgates open, so to speak, everybody's message is going to go out there, and it's going to be very competitive to get your message seen. So it takes dollars to do that. And we will be allocating a good part of our budget to marketing. The convention center marketing, again, that's part of our overall budget. So that $1.3 million includes the convention center's budget. The convention center's budget has to be approved by our board, and it has been. So the 2020-21 projections for the convention center fund is $311,000. That is 1/3 of that 933 or 934 that we have. The GCC marketing reserve is $73,000. So their total budget added together will be $385,287. And we give those funds to the convention center on a monthly basis. So they send us reports about what they're doing, their expenses. We approve those expenses, and then we send them a check each month. And that check can't cumulatively go over $385 next year. So that's their budget. And again, we're working with a lot less, just like everyone else, but we're committed to marketing Greenville and Pitt County. We're committed to bringing travelers back. We know how important that is for the success of our small business and for sales tax generation. But I'll be happy to answer any questions that you have at this point.
Mr. Chairman, there's no hands up at this time unless a commissioner would like to pose a question for Andrew.
Anyone have any question for Ms. Andrews? I hear none. Again, thank you, Ms. Andrews, for your fine presentation and continuing the good work and utilizing that virtual.
All right, thank you.
Yes, sir. Thank you.
I'm sorry, we do have Mary Perkins Williams' hand has been put up now.
Commissioner Williams.
And to maneuver my mouse and all this and then get the hand raised and everything, but I do have questions for Mr. Andrews. Your budget, is he gone?
No, I'm right here.
Oh, okay. Your budget for last year, what percentage of that has been spent?
We're about 90.5% of that's been spent as of June 1st. So there's certainly things that for the rest of the month, payroll, rent, electricity, things like that. But we should be able to salvage about $50,000 of that budget for the reduction of using our fund balance for next year. I think the hard part is to be prepared for if there's a second wave of COVID and if there's a second situation that comes through where travel is virtually stopped again. So we can't be sustainable with the kind of revenues that we're bringing in through occupancy tax for a 12-month period. So I'll give you an example. We took in $34,000 in occupancy tax for the month of April. Last April, we took in $108,000. So that's a major difference. So we're trying to save as much money on this year's budget as we can, and we're looking at maybe $45,000, $50,000 that we'll save.
Are you asking the county for any amounts of funds here? I was looking at your presentation and I see you give money to Greenville Utility. Greenville Utility, Greenville City and Are you asking the county for money, or are you expecting to get some money, or you just
No,
presenting to us?
No, we present because we represent Greenville and Pitt County, so we present to the city council and to the county commissioners. We've never, in the 30+ year history, have received any funding from the county or the city. We're funded solely on the hotel motel tax. And we budget accordingly because we know that, especially this year, that there's no extra revenues for our office through the county or the city. So we're not asking you guys for anything.
I like to know one thing, because I know that entertainment is very slim for people of color. So I'm asking, what does your board look like?
It's diverse. I think we've got,
How many females, how many males, how many Hispanic, how many white, how many blacks?
I would say 3 African-American, 1, no, she's not Hispanic. So without looking at the list, it's hard for me to tell. We have 12 board members. The thing about our board is it is a very, through statutes in the North Carolina General Assembly, I have to have people that work for hotels. I have to have people that work in the tourism industry, and I have, your general folks that are just interested in tourism. So Dee Dee Carney is an individual that's our vice chair. I'm sure you know Dee Dee. Diane Taylor is on our board as well. Bree Lester is on our board with the Holiday Inn Express. We've got Jeanette Blackman as part of our sports commission board. So we've got our makeup for females is 5 to 7.
Okay, how many females are white?
I believe 3.
Okay. I just wanted to make sure, because with all the things that are going on in society now, that has become more of an issue for me, that it is that we resemble the community in which we serve or service. Funds, money. What else in your board, in your budget, do you cut?
So out of the 25% that's cut, obviously salaries is the major thing that we're cutting, not because we're having to lay anybody off, but because we do have 2 individuals that are retiring.
Got that.
And we cannot rehire those 2 individuals to save money. We are a marketing organization. So, we have to travel to bring people to Greenville and Pitt County to talk to and sell Greenville and Pitt County. So marketing has not been cut. Contracted services has been cut. Our travel budget has been cut as well. And so printing things that are of non-essential nature, our printing budget was cut by $25,000 because and we were going to cut that anyway down because we want to be more environmentally friendly and do a lot more digital pieces. So we don't have an extensive amount of funding, so we don't have a number of extensive line items, to be quite honest.
There's one question I want to ask you. There's a group, there's an office maintained at the convention center, and there's a group downtown. What's the difference in the 2?
So the convention center is a department, it's part of the city of Greenville. So the city leases the land to the convention center group, which is called Exhibit Hall Managers. And so they are funded through our budget, but they are a separate organization. So the city has us take part of that occupancy tax and give that to the convention center for operations and marketing, building upkeep, and so forth. As part of the interlocal agreement that was signed way back in, 2001, the Hilton and the Hampton and the Holiday Inn have to provide some support services to the convention center. So if you have an event at the convention center, you're using Hilton staff, and the city does not pay for that. So it's 2 separate groups. I'm part of the group that's downtown. We're the Convention and Visitors Bureau. Our job is to market Greenville and Pitt County. We market every hospitality asset that we have in Greenville and Pitt County to bring people to come spend money in Greenville for whatever it's leisure or meetings or conventions or sports or what have you, family reunions. That's our job, is to market Greenville, Pitt County. The Greenville Convention Center is a meeting facility that hosts obviously meetings and conventions, and they market themselves. And so it's a good asset for Greenville and Pitt County, because without that center, we couldn't bring, 1,500 people here for the United Methodist Conference, or we couldn't bring 1,000 people here for the League of Municipalities or the County Commissioners Association state meeting. So it's a very important component of what we have, but the CVB looks at every tool that we have to bring people to Greenville and Pitt County. So those are the differences.
So with the two separate organizations, there are a total of how many staffers?
We have 7 for now. And
With
that'll
both
go
of
to-
them?
No, ma'am. CVB has 7 and the convention center has 4, well, 1, 2, 3, 5 full-time and several part-time employees, depending on need. How busy they are, banquets and things like that.
And you pay those salaries out of,
Ma'am.
don't pay them out of money that we give, but you pay it out of the city.
Right. Well, and again, Ms. Perkins Williams, you don't, the county doesn't give us any money.
I know that. I was just trying to understand what it was since you're here. And I did not know, and I was trying to figure it out, but I like hearing your report. I get a chance to ask you questions because I've always wondered about 2 separate entities. Thank you.
Yeah, thank you. And if you ever want to come by our office when it's safe to do that, I would love to sit down with you and explain more.
Okay, thank you very much, Mr. Smith.
All right, thank you.
Thank you.
All right, Mr. Chairman, at this point, we have concluded the 3 presentations for the day. I don't know if there's any questions or input or feedback the board would like to give us. Otherwise, until we recommend at the end, we recess this meeting until tomorrow, which we will pick back up at 8 a.m., not 8:30, but 8 a.m. to begin day 2 on Wednesday, June the 3rd. So, Mr. Chairman.
Okay, very good. Do you have any questions or comments from the board at this point? If not, we will resume the meeting tomorrow at 8 o'clock, and we'll see you then. Meeting adjourned.
We're